Hello, Mr. Fader. My name is Scarlett. I'm going to be your nurse, and I'm going to do a peripheral vascular assessment as well as a head, eyes, ears, nose, and throat, and a lymph node assessment, okay? So let's start off with your peripheral vascular. We're going to do an inspection of your upper extremities, okay? I've inspected and I've noticed the size. Size is symmetric and goes along with your body. I've not noticed any edema and no enlarged veins, okay? The color is pink as well. I'm going to inspect your lower extremities, okay? And I'm also looking at the size. They're both symmetric, and there's no edema noted. I don't see any venous enlargement, no rashes, ulcers, or scars. I'm going to palpate your upper extremities. They have been warm, I've noticed, and I'm going to check the pulses out, okay? I'm going to first check your radial pulse. Great. And your brachial pulse. Wonderful. They are a 2+ Fritz, which is normal. Okay, I'm going to check out your other pulses. We've got your femoral pulse, which is right by your groin area, as well as your popliteal, which is going to be right behind your knee, your dorsalis pedis, right on top of your foot, and your posterior tibial. I'm going to use this one, right near that ankle bone. Okay, moving on to inspect your head. If you don't mind, sit up for me. I'm going to look at your hair. You've noticed that you probably either have washed your hair or you shave it. Which one is it?
I've washed it.
You've washed your hair. Okay, so
Male
you
pattern
have
baldness.
male pattern baldness. Okay, a little alopecia going on there. Okay. Okay. So if you did have hair, I would look at the quantity, the distribution, as well as the texture. Okay. I'm looking at your scalp now, Mr. Fader. I don't notice any scales, any lumps or lesions. With your skull, it is a normal size, as well as the contour is round. Okay, no deformities or depressions noted. And was there any tenderness when I was touching it? No? Wonderful. I'm going to inspect your face. Okay, with your face, it is symmetric. No edema or mass is noted, and I haven't noticed any involuntary movement. With your skin, again, it matches from your upper extremities as well as your lower. It is pink in color. The hair is evenly distributed on your arms and your legs. The texture is smooth and normal pigment as well as no lesions noted. Okay, we're moving on to inspect your eyes. I'll look at your external eyes, and I don't notice any inward or outward deviations, and the alignment is good. Great. Eyebrows, they are evenly distributed, the hair on those, as well as no scaliness noted. With your eyelids, they're normal width and color. The color is pink, matching your body, and no periorbital edema noted as well. Normal closure, your eyelashes are normal, and no lesions. So when I'm inspecting your conjunctiva, I have noticed there's no nodules. Okay, so I'm going to just pull those down, and there's no swelling, and it is pink and moist. Okay. Your sclera, I notice, is white. No yellowing or jaundice noted. And I'm going to check out your pupil size. Okay? Just going to measure those. Looks to me like it's about 4 millimeter. Okay, that is normal. And they're round and equal as well. Okay? I'm going to check the pupil direct reaction as well as the pupil concentric reaction. Now, I'm going to use a pen light. Would it be okay?
It's fine.
Great. Just look over here at me. I'm going to have you look in the distance. Okay? You focus on an object, and I'm going to just pass a light. Alright? Now, I do notice a constriction in the right eye. Constriction in the left eye. Now, I'm going to test the pupil concentric reaction. Now, I'm going to do the same thing. I'm going to notice the opposite eye. It does constrict. The opposite eye constricts with both. So that is normal. The pupils are equal, round, and reactive to light and accommodation. Great. Now we're going to move on to inspect your ears. I'm looking at the auricles, and there's no deformities, lumps, or lesions noted. Great. Now I'm going to look at your nose. Externally, I don't see any deformities, and it is symmetric as well. Now I'm going to look at your nasal mucosa with my pen light again. Now I'm going to have you tilt your head up, and I'm going to press on the tip of your nose and just look in there. Okay? It is pink. I do not notice any swelling, no bleeding exudate, or any issues. Okay, so I'm going to look at your nasal septum. Now, there's no deviations noted either. No perforation or inflammation either. So that's great. I'm going to palpate your sinuses, your frontal and your maxillary sinuses. When I'm palpating your frontal sinuses, I'm going to press upward on your eyes. You tell me if that hurts.
No.
No? Okay. Your maxillary sinuses are right under your cheekbone. Is this area tender?
No.
Great. Now, I'm going to inspect with my pen light. Look at your mouth first. It is pink, moist. I don't notice any cracks or lesions. So now I'm going to look at your oral mucosa. So if you don't mind, just open your mouth for me. Okay. It is pink. I don't notice any white patches or ulcers. Now, with your gums, you kind of hold your mouth up a little more. I'm going to look at your gums. The gums are pink, no swelling or ulcers. Now, with your teeth, I've not noticed any missing, discolorations, or abnormal positioning. Now, when I look up at the roof of your mouth, please, the roof of your mouth, your palate is intact, and it is pink. Now, if you can stick out your tongue for me, okay, I've assessed your hypoglossal nerve. Now, that is your cranial nerve 12, and that is positive. Okay, I'm going to look at the floor of your mouth. Now, hold your tongue up. Perfect. And I don't see any white patches, and it is pink. Now, I'm going to go ahead and move on to look at your pharynx. I'm going to have you say ah for me. Ah. Great. It is pink, no ulcerations, no white patches, and everything looks normal so far. Great. Moving on to check out your neck. I'm going to inspect the neck and palpate it as well. Noticing the trachea and the thyroid. Okay? So I'm going to first inspect the trachea. Now, I do not see any deviation noted in the tracheal area. I'm going to palpate. Now, I notice it is symmetric. Okay, everything looks great so far. I'm going to inspect your thyroid. I'm going to have you tilt your head back for me, okay? Thank you. I'm going to look below the proctal cartilage. Okay? And I'm going to palpate the thyroid. I'm going to have you swallow for me. Right, and I felt at that time for the rise and fall of the thyroid. Now, I'm going to displace the trachea to the left and right and see if it goes back to the side. And that is definitely positive. So that's normal, and that's great. Was there any tenderness noted when I was feeling the area? No? Okay, great. There's no enlarged lobes, and it's normal shape and size. Now, we're going to move on to your lymph node system, okay? This is very important, and we're going to notice if there's any inflammation or swelling in this area or tenderness, you could have an infection going on, okay? So let's see how this looks up. Now, some of these lymph nodes I'll not be able to feel. They would be small, mobile, and non-tender. That would be normal for us with the shoddy appearance. So I'm going to palpate here with the lymph nodes. Now, I'm going to look at the preauricular. You can notice right here, that lymph node area is right here on both sides. The postauricular is located here. Okay? We're going to move on to check out the occipital. The occipital is around the back of the head. Okay? And I'm going to let me know if it's tender, okay? You just let me know. Great. The tonsillar is right here. Okay? And we're going to check out the submandibular, which will be under this area. And we're going to look at the submental, which will be right here. Great. Now, we're going to look at the superficial cervical. Now, the superficial cervical is right here. Alrighty. Now, going on from there, we're going to the posterior cervical, which is right in this area. Okay? Moving on to the deep cervical chain, and that's located right around this area. Then we're going to check out the supraclavicular, right above the clavicle area. And the epitrocular, which would be right in this area, right above your brachial. Okay? And I haven't noticed anything abnormal, no enlargement, and everything on your assessment has turned out great. Thank you very much for your time.